Welcome to the Daily Briefing for Thursday, August the 20th. Mayor Koplin is with us on this one today. Just in case you thought you were going to have to endure me by myself again, we have a guest, and there is some encouraging news to share. I want to mention quickly here at the outset, before we get to the conversation with the mayor, that we had the talk show this morning about the schools and talk to the superintendent and the school board president. If you missed that program, it should be up at youtube.com/Cordova TV. So you can hear that and hear from those folks directly about how that's going to work. We won't be talking about that with the mayor today because that's school board business and not so much mayor business. But there were some other things to discuss with Mayor Koplin, so we'll get into that now. Again, daily briefings, weekdays, 1, 5, and 8 p.m., and uploaded to youtube.com/Cordova TV for online listening. So we'll start with some good news with the mayor here. All right, Mayor Koplin, it's been a little while, which, is, I keep mentioning the no news is good news categories these times that I've been filling in, but it's nice to not just be sitting here by myself. And there's another bit of good news is good news, so you go ahead and announce it.
You bet. Today, the city of Cordova is moving from Health Alert Level 3 down to Health Alert Level 2. So that did become effective this morning at 8 this morning. And that is an advisory that comes from having no positive COVID cases in Cordova in the last 14 days. And our testing and contact tracing and hospital capacity are in really good shape. So under this Level 2 advisory, the city emergency declarations may still be requested by the mayor, the city council, and or the city manager with the Cordova medical team's recommendation. The incident management team and the emergency operations center may be implemented. And in an advisory status, if the city continues to see downward trends and all is going well, then we'll methodically move to lift the restrictions that are currently in place. The city may follow the state's lead after the Cordova medical team and city council confirm transition is justified using the metrics recommended by the state. And for more information on this announcement and update, you can continue to find that and other information on the City of Cordova COVID-19 Health Advisory Plan. And that's available on the COVID-19 website, City of Cordova.
Yeah, covid19.cityofcordova.net. So, certainly good news. Nothing, though, that should compel us to be more lax in our protective behaviors, I assume?
No, that's the interesting thing we've experienced. If we remain vigilant, the cases go down and stay down. We start relaxing, and it seems like there's a corresponding bump that follows not long after. So it is important, particularly with a lot of tourists and travelers still coming to the community, to remain vigilant and follow those protocols. On the subject of people coming in from out of state, sort of you categorize this, I guess, as like a public service announcement for those who know they have people coming in, whether it's family or clients to fish or something like that. But there's been a bit of confusion over the type of test that some out-of-state travelers are coming into the state with. So what has been the challenge there? Well, good point. On the one hand, it's with the requirement to have testing before you come to the state. It's helped relieve some of the pressure on our local medical teams that file those tests. But what they're seeing is that some people don't understand that the state is requiring what they call the PCR test, and that's to confirm the presence of active virus. And so some travelers are arriving. They've gone to great lengths to locate and pay for and get a test, and only to find out that it's an antigen test and that's not accepted by the state mandates. So they get very frustrated, of course, with our local team and with the fact that they've already paid to have a test, and only to find out they need to get another one. So our medical team asked that we please spread the word that if you have travelers arriving or you operate a lodge or any kind of correspondence with people planning to travel to Cordova from outside the state, get that the proper test, the PCR test.
Okay, again, PCR test. And is that outlined in the mandate? Have you read the text of it recently?
I haven't. I've been a little removed from mandates, and I understand there's differences between tests, but I haven't dove into the medical nuances.
Yeah, well, it'll be worth looking up. But again, if folks can remember, the PCR test is the only one that's acceptable, unless we end up hearing differently from the state. So those folks that we know are coming up here, at least we can help those that we know about. And the others, yeah, it must be tough to be on the front line because it's not like our local workers' fault. But they, of course, are going to bear the brunt of anybody's frustration on that. And it's nice that they continue to do that job because it really helps keep us safer. We used to talk about in the earlier days of this all of these different types of meetings that were done to maintain vigilance and share ideas, and you were frequently part of these. Has that level of activity died off as we've kind of gotten into cruise control, or is there still really a lot going on in the background to maintain that vigilance?
There's still a lot going on in the background. We have, I think, weekly. We still have weekly. I get the notifications, White House briefings. This last week, and listening to our incident team is particularly helpful as they spend a lot of time explaining the programs and the support that are available to businesses and communities for COVID-19, and also health updates and advisories and information. Closer to home, we have, there's several groups that meet. The ones that I pay particular attention to, the state incident management team, and then the state fisheries industry meetings, and those are still weekly. And in fact, they're doing quite a bit of work to take what we've learned and what we know and kind of rationalize it into next year. Because they expect that a lot of these mandates and risks are going to carry forward into next year. So they're trying to capture and kind of memorialize what worked, what didn't, and carry it forward. And then right here at home, we're still having the weekly meetings of our incident management team, but our medical team continues to meet daily. They post the daily dashboard. They're in contact with the incident management team daily. So there's still daily work that goes on by our incident management team. It's just very localized to a few people. And again, the broader spectrum is available if there's a sudden shift and we need to re-energize and mobilize some of those resources.
Okay. Well, I kind of figured that would be the case, but it's always kind of hard to tell when it's not out in front of us like it was, certainly in the earliest days of this and up until fairly recently. So it sounds like that goal of learning to live with the virus instead of under it, or whatever the phraseology was.
Another theme from the White House briefings on the more positive side is the potential for vaccines to become available. And that's both an opportunity and a challenge, because just like the testing kit availability, there's going to be a limited supply to start with, and identifying the groups most at risk and work to distribute those, and then as production ramps up. So, and then of course there are those who refuse or do not like to be immunized. And so these are some of the things they're grappling with right now. So the good news is we're closer, it looks like, to having some effective immunizations available, but it's going to take some structured work to roll that out.
Yeah, I saw an interview Dr. Zink was doing about that recently with KTUU about, the potential for, Alaska to be able to participate in that as soon as possible, and she seemed fairly optimistic. So we'll continue to hope so, and see what that means in terms of, like you were saying, next summer having to be largely the same as this summer, or maybe some differences. but who can possibly predict at this point? Mayor Koplin, thanks very much for joining us today.
Great, thank you.
Our thanks once again to Mayor Koplin for joining us on today's Daily Briefing with some encouraging news. Want to remind you again that if you missed our talk show with the school superintendent and school board president, that is uploaded to youtube.com/Cordova TV, as will this program be, as soon as we can get it up there for you. Remember, COVID-19.cityofcordova.net for the latest information from the city, 424-INFO. If you want to talk on the phone to somebody at the city about COVID-related business, the 424-WELL phone number is available from the Village of Eac with their pre-recorded update. And we thank you for joining us for today's briefing. We'll see you tomorrow at 1, 5, and 8 p.m. and youtube.com/Cordova TV.